What is the correct dosage of Suboxone? Suboxone is a medication used to treat opioid use disorder or opioid addiction. People seeking Suboxone treatment may want to know the proper dosage of Suboxone before they start taking the medication. It is essential to treatment, as the correct dosage can help ensure recovery success. So how could you know if you're taking the appropriate dosage? In this video, we'll discuss Suboxone dosing. We'll talk about what Suboxone is, how it's administered, how dosing works, and the recommended starting dose. We'll also discuss how the dosage might change after the first day of treatment and the highest prescribed dose. Let's get into it. Suboxone is an FDA-approved medication used to treat opioid addiction. It is a combination of buprenorphine and naloxone. Buprenorphine is a partial opioid agonist. It activates the same receptors in the brain as opioids, but with a weaker effect. Naloxone, on the other hand, is an opioid antagonist which blocks opioid effects. Because of this combination, Suboxone can help reduce opioid cravings and withdrawal symptoms while preventing the person from getting high. Suboxone is generally safe and effective, and that's why you'll see it in medication-assisted treatment or MAT programs. It is part of a long-term treatment plan to help people manage their addiction and recover from it. According to clinical studies, the success rates of Suboxone are relatively high. But as with any medication, there is always the potential for side effects. The most common side effects of Suboxone include headaches, nausea, vomiting, and dizziness, constipation, drowsiness, dry mouth, excessive sweating, irregular heartbeats. These side effects are usually mild and go away after a few days. But if they persist or become severe, then reach out to your Suboxone doctor immediately. Suboxone is a sublingual film administered to patients suffering from opioid use disorder. The film is dissolved under the tongue and absorbed into the bloodstream. Patients must not chew, swallow, or cut the film while it's dissolving. Eating or drinking anything is not advisable until the film has completely dissolved. Suboxone is usually taken once a day, but some patients may need to take it more frequently, depending on their circumstances. Some patients also need to take an additional film in their daily doses if their addiction is more severe. Your doctor will determine your dose based on your needs. Suboxone is a Schedule III controlled substance. It has a lower abuse potential than other opioids. However, it's still possible to abuse Suboxone, so taking it as your doctor prescribed is crucial. You should speak to your Suboxone doctor before starting initial treatment if you are pregnant or planning to become one. There is a potential risk of neonatal opioid withdrawal syndrome, or NOWS, if you misuse Suboxone during pregnancy. In addition, people taking Suboxone should not drink alcohol or use other drugs while on medication. Doing so can lead to serious side effects and even death. Taking Suboxone as prescribed and following your online Suboxone treatment plan is crucial to avoid complications. It would be best if you took the correct Suboxone dosage according to your doctor's instructions. For example, if your Suboxone doctor tells you only to take 10 milligrams a day, don't take more than that. Taking too much Suboxone can lead to serious adverse effects like seizures and respiratory depression. Suboxone dosing works by starting with an initial buprenorphine dose that is then adjusted based on the individual's response. The initial dose may be increased or decreased depending on the person's opioid dependence, tolerance, and needs. The goal of Suboxone dosing is to find the minimum effective dose that will allow the individual to function without experiencing severe signs of withdrawal. A 2 milligrams dosage is sufficient for some people, while others may require higher doses. Your Suboxone doctor will closely monitor your progress and make necessary adjustments to your dose. Following the instructions of a medical professional when adjusting dosage is crucial, as too much or too little of the medication can be dangerous. When you start taking Suboxone, your doctor will advise you to begin with a single dose each day, though some people may require more frequent doses depending on the severity of their addiction. The starting dose is usually between 12 and 16 milligrams per day for most patients. However, your Suboxone doctor will determine the best dosage based on your needs. Here are the following available strengths of Suboxone films from lowest dose to highest: 2 milligrams buprenorphine and 0.5 milligrams naloxone, 4 milligrams buprenorphine and 1 milligram naloxone, 8 milligrams buprenorphine and 2 milligrams naloxone, 12 milligrams buprenorphine, and 3 milligrams naloxone. When starting Suboxone treatment, it is essential to begin at a low dose and gradually increase the dosage as needed. According to Suboxone.com, the recommended starting dose for Suboxone is 8 milligrams by 2 milligrams on day 1, taken in divided doses. However, most medical professionals will give you a lower starting dose of Suboxone to minimize the risk of side effects and monitor how you respond to the medication. In such cases, they will give you 2 milligrams by 0.5 or 4 milligrams by 1 milligram in divided doses until you reach the recommended starting dose of Suboxone at 8 milligrams by 2 milligrams. Your Suboxone doctor may adjust your starting dose on day 1, depending on the severity of your addiction, your medical history, and the symptoms you've experienced after your initial dosage. It's also essential to note that your initial dose timing depends on what type of opioid you've been taking. If you're coming off a short-acting opioid like heroin or hydrocodone, your doctor will give your first dose of Suboxone at least 24 to 48 hours after your last dose of the opioid. On the other hand, if you're coming off a long-acting opioid, such as methadone, your first dose should be taken at least 48 to 72 hours after your last dose, since it takes longer for this type of opioid to leave your system. After the first day of Suboxone treatment, your doctor may increase the dose to 16 milligrams by 4 milligrams. It is the recommended maintenance treatment for most patients, according to Suboxone.com. However, you should not take the dose as 2 8 milligrams by 2 milligrams tablets or 4 milligrams by 1 milligram thumb strips as a single dose. The total daily dose should not exceed 16 milligrams by 4 milligrams. If you still experience withdrawal symptoms at this dose, your doctor may still increase it. But if your withdrawal symptoms are managed at this point, your doctor may have you stay at this dose or even reduce it if they think it's appropriate. The maximum recommended dose of Suboxone is 24 milligrams per day. It is only prescribed to patients who have not achieved stabilization at lower doses, and even then, the dose is increased gradually over time. Most patients will not need more than 16 milligrams per day. Doses above 16 milligrams per day are considered high doses, but they may be necessary for some patients. A study by PubMed has shown that patients taking more than 16 milligrams per day of Suboxone have a higher chance of continuing treatment than those taking lower doses. It is likely because higher doses are more effective at treating withdrawal symptoms and cravings during the first few days of treatment. However, it's essential to note that taking a higher dose of Suboxone does not guarantee treatment success and may lead to more side effects. It would be best always to ask your doctor what dose is correct for you. When it comes to Suboxone dosage, there is no one-size-fits-all approach. The amount of medication necessary to recover from addiction will vary depending on several factors, including the severity of the addiction, the individual's physiology, and the presence of other mental health disorders. However, higher doses of Suboxone are associated with better outcomes. As mentioned earlier, a study has shown that patients receiving higher doses of Suboxone are more likely to complete treatment and stay sober in the long term. There are many reasons why this may be the case. First, high doses of Suboxone help minimize withdrawal symptoms and cravings, making it easier for patients to stick to their treatment plan. Additionally, high doses reduce the risk of relapse by blocking the effects of other drugs. Finally, high doses provide a more significant margin of safety in case of accidental overdose. A qualified Suboxone doctor should decide how much Suboxone you can take. The daily limit for Suboxone is 24 milligrams per day. Anything above this amount is considered too much. A Suboxone overdose is rare, but it can happen, especially if a patient doesn't follow their doctor's directions or takes Suboxone with other drugs. Symptoms of a Suboxone overdose include slow breathing, slurred speech, drowsiness, abdominal pain, confusion, seizures, loss of physical coordination, and death. Now that you know more about Suboxone and its dosage, you might wonder if it's the proper treatment. Suboxone is an effective treatment for opioid addiction, but it's not suitable for everyone. The best way to determine if Suboxone is a good fit for you is to speak to a Suboxone doctor. During your consultation, your doctor will ask about your medical history, drug use, and your goals for treatment. They will then determine if Suboxone is the best option for you. If you're struggling with opioid addiction, don't hesitate to contact a Suboxone doctor today. Visit SuboxoneDoctor.com to find one quickly. Our platform can help you find a qualified Suboxone doctor in your area and get started on the road to recovery.